tomorrow, CDC vaccine advisors are going to be taking up the issue of whether to resume use of the Johnson & Johnson vaccine. The meeting comes as the FDA found serious violations at that Baltimore emergent facility where the vaccine is made. Up to 15 million doses, you may recall, had to be thrown out because of possible contamination. Lots to break down this morning. Who better to do it than Dr. Ashish Jha? Dr. Jha, of course, Dean of Brown University School of Public Health. Dr. Jha, good morning to you as always, sir.
Good morning. Thanks for having me back.
Let's start with this J&J discussion, Dr. Jha. Since the release of that FDA report, Johnson & Johnson and Emergent, they've both released statements saying they're going to resolve these issues. We also heard on Wednesday, European Union regulators finding this possible link between the Johnson & Johnson vaccine and rare blood clots, but they did reiterate that the benefits outweigh the risks. Dr. Jha, do you think that we're going to see J&J vaccine production resume here in the United States in the near future?
Absolutely. I expect the advisory committee of the CDC tomorrow to unpause the pause that we've been in and let people start getting vaccinated again. Look, these are extraordinarily safe vaccines. They're much, much safer than most medicines that we take, most vaccines that have been given out. These are just what the problem is that we are vaccinating hundreds of millions of people around the world. And even 1 in a million events, we identify them because we have a really vigorous safety monitoring system. And that's what is happening here. But there's no question I would feel comfortable getting it. I'd feel comfortable with my family members getting it. I think it's a really safe vaccine, and I expect the pause to be lifted tomorrow.
Speaking of family members, let's talk about kids for a moment. According to the American Academy of Pediatrics, more than 88,000 new COVID-19 cases in kids were reported last week. That's a 5% increase from previous weeks. And, we're finally starting to see teens as young as 16 get vaccinated. Do you think we'll see younger children getting vaccinated and become eligible? And if so, when do you think that could happen?
Yeah, I hope so. And I expect that for 12 to 15-year-olds, and that's personal for me because I have two in that age range, 12 to 15-year-olds, I'm hoping will happen in the next month or two. Pfizer data on that group looks fabulous, and the FDA is looking at it. And my hope is in the next month or so they're going to authorize it for that group. The challenge is younger kids. And the issue there is the studies are ongoing. We probably need a lower dose. There's a bunch of work that needs to be done. And so that group may not get vaccinated until the end of the summer, fall, maybe even the winter. Just depends on how long the studies take. We want to do the studies carefully and make sure it's safe. And that's why we're going to probably take a little while to figure that out.
Dr. Jha, I want to talk about outdoor masking. I know you've said that soon some states will likely ease the outdoor mask mandates. Personally, I'm walking my 1-year-old son in his stroller, and I live in a neighborhood where there are a lot of runners, and they're running right next to us. I mean, breathing right on us. Could there really be a benefit to not wearing masks outside?
Yeah, so first of all, I think anybody who wants to obviously should continue to wear masks. There shouldn't be any prohibition against it. But if you even take that example of the runner who runs by, what's the risk? The answer is it's infinitesimally small. It's just incredibly low. I'm not aware of any case in the entire pandemic where somebody walking by somebody, running by somebody infected another person. It's just sort of not how infections work. You have to have sustained exposure for some period of time. And so I know it feels uncomfortable for a lot of folks, but I do think we're going to see a lifting of the outdoor mask mandates. And it's probably okay from a safety point of view.
And Dr. Jha, from a vaccine point of view, more than half of all adults in the U.S., at least one vaccine shot, but demand is slowing down in some states. Is it because of this vaccine hesitancy, what they've heard about J&J? How do we get people to go, okay, let's go, let's get these shots going for the rest of us?
Yeah, it's a really good question. Right now, what we have done is there's a group of Americans, I was one of them, who are vaccine avid, really, really wanted the vaccine. That group has largely now been vaccinated. The next group I would not say is hesitant. There are a lot of people who are happy to get it, but won't jump through the hoops and can't jump through the hoops. We should make it super easy for them. There are other people who have questions about how safe these vaccines are, and we should be talking to them and addressing them. I really do think we can get a vast majority of Americans vaccinated if we treat people with respect, we reach out and understand their concerns, address them. We don't have to get everybody, but I think we need to get most people, and I think we can.
It was interesting to hear Dr. Walensky say earlier this morning that at this point, some 90% of Americans live within 5 miles of a vaccine site. Dr. Jha, thanks as always, sir. Thank you, thank you, thank you.
My pleasure. Thank you.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.